And it's really for, listening to the patient and the doctor conversation, and then documenting the encounter. And this could be, it could be a Bluetooth speaker in the physician's room. It could be part of telehealth as well with our partner Vonage. There's a number of ways to be able to, to use this solution. So let me just launch this.
Hey, Dean, how's it going?
And we're going to do an in-office medical exam. So we'll do this as myself. And I'll put in 1970. All right, so at this point, our technology is listening to the entire conversation, what people are saying. So it would listen to, even the, when the patient comes into the doctor, a lot of times when you have a relationship with the doctor, you've known the doctor, there's a lot of banter that happens up in the beginning of the exam, right? And we do a great job of filtering all of that banter out and just focusing on the medical pertinent information when we generate the medical note. So Hugo, let's get going on it.
Okay. Hey, Dean, how you doing? Good to see you again.
Yeah, great to see you again, Hugo. How have you been? Well, we got together over the weekend. It was great to see you then, and I saw you a couple of days ago as well. How's everything going? How's the family?
Good. It was a nice, relaxing weekend. So, Dean, let me ask you. So, what brings you in today?
Well, yeah, this was after. I should have mentioned this at the beach barbecue, but I didn't. So I've got some abdominal pain, and I wanted to get it checked out.
Okay. Well, let's talk about that. So, tell me about this abdominal pain. How long have you been suffering from that?
Well, it's been going on for quite some time. I'd say probably about 6 months.
6 months. Okay. And where's this pain located when you get it?
Well, I'll point to it. So it's kind of up here in the upper right part of my abdomen.
Okay, so your right upper abdomen, right upper quadrant. Okay. And does it go anywhere? Does it stay there? Does it radiate any other part of your abdomen or to your back?
Oh yeah. It definitely radiates to my back. I can feel it in my back.
Okay. When you get this pain, how would you describe it? Is it crampy or sharp or dull? How would you describe the pain?
I'd say it's severe, but it's kind of a dull pain, and it kind of comes and goes in waves.
Okay, so maybe that is kind of crampy if it comes and goes. And how long do you think it lasts when you get it?
I would say it's probably about like 30 minutes sometimes, but sometimes it could be all night.
Okay, so it can last all night. And have you noticed that, eating makes it worse?
Yeah, it definitely does. And it's interesting because it also depends on, what I eat. Like if I'm eating some like fried food, which I love, that definitely, creates more of the problem.
Okay, so fried food makes the pain worse. And this might be a weird question. Let me ask you, have you noticed any yellow discoloration of your eyes?
Yeah, I do. Yeah, my wife actually said, "What the heck is going on with your eyes? They look a little yellow."
Okay, and so that's interesting. And what about any discoloration of your urine?
Yeah, it's kind of an orangey color, kind of
Okay.
orange. Yeah, it's kind of strange. So I started having that, and I got, boy, I need to see Dr. Barrera.
Okay, well, I think that was a good choice. Have you had any weight changes?
No, but I wish I did.
Okay. Well, I think I'm beginning to get an idea, Dean. Why don't we do a physical exam?
Okay.
So I'm going to listen to your heart. Sounds regular rate and rhythm. Your chest. Take some deep breaths in and out.
Okay.
Chest is clear. I'm going to examine your abdomen. So if I push here, does that hurt?
Yes.
Okay, so I'm pushing at your right upper quadrant. That you have tenderness there? That hurts?
Yeah, it does. Yeah, I can feel that. Yep, it hurts.
Okay. And I'm kind of tapping. You're not bloated, and you have normal bowel sounds. I'm going to have you do this. I'm going to push right here at the right upper abdomen. You're going to take a deep breath right now.
Okay.
Okay, and I see that you caught your breath there. Does that cause pain when you deep breathe and I'm pushing?
It does. Yeah, it definitely causes pain. Yep.
Okay, that's called a Murphy sign. So that, okay, this is interesting. I'm gonna examine your legs. Okay, you have no edema in your lower extremities. So here's the impression, Dean. I think you might be suffering from gallstones or biliary colic. It's called cholelithiasis, and that could be causing your pain. But the yellowness in your eyes and your discoloration of your urine also makes me think maybe you have a stone, a common bile duct stone that might be causing a partial blockage of your liver. That's called choledocholithiasis. So this is what we're going to do. This is our plan. So number one, I'm going to order an abdominal ultrasound. We'll check for gallstones. Number two, I'm going to order liver function tests to see if you have jaundice. Number three, I'm going to have you come back. We're going to review those studies, and based on what we see, we'll decide if maybe you'll need a potential cholecystectomy, which is a removal of the gallbladder. And also based on the liver test, we might see if you need to get referred to a GI doctor for what's called an ERCP. That's an endoscopic procedure. It's like a scope where they can remove those stones that might be in your bile ducts. Does that make sense?
Yeah, it sounds kind of scary, but I get it. Makes sense.
Yeah, whatever it is, there's going to be a solution for this. So I'll get those ordered, and we'll see you soon.
Great. All right. Thanks for good seeing you again. Thank you.
All right. Have a good afternoon, Dean.
Yeah, you too. All right. Thanks, Hugo. So, all right. So now the system is analyzing what, everything that was said. Right now, this is kind of like, it's thinking, the AI is thinking out in the cloud, looking at the conversation. And you could see that it was a very natural conversation, a lot of back and forth banter, a lot of medical terminology that was intermixed with this. And most people think about voice recognition as just dumping a bunch of bag of words, but this one, the next level, the next generation of our solution is to be able to take what was said, that whole bag of words, and put it into a medical note.
I've completed reviewing the session. You can view it on your Quantum Health portal.
So that took like, seconds to complete, probably like 30 seconds. So here you can see the exam. I'll click into it so we can read it. And Hugo, you can comment on this as well. So the history of present illness. Actually, Hugo, do you want to talk about this? Is a standard SOAP note, right? A subjective, objective assessment and plan note that every physician needs to document, correct?
And this is actually more of a history and physical. So the SOAP note is usually a progress note, like a follow-up note. So this would be the first formal introduction between a patient and physician for a particular problem. And it has very discrete subsections. So the first is a history of present illness. And then it typically goes through review of systems, which is going through a systematic approach to the body. And that review of systems is generated based on what the physician and patient have talked about. So what's presented in the history of present illness is usually in paragraph form, and then you take out data points that you've acquired from that, and you put it into the review of systems. It's sort of a quick checklist. And then typically you'd have past medical history, past surgical history, social history, and that all is, the patients fill that out beforehand, so that just gets templated in. And then the next part is physical exam, impression, and plan. And so, and Dean, it's interesting, if you were to show the raw data, like it's so verbose, and then this just compiles from that raw data all the important data points.
Yeah, this is the entire conversation of everything that was said here. And then we take that and we analyze it. And what Hugo is saying here is, out of that whole bag of words, we picked out that the chief complaint was I came in for abdominal pain. And then this history of present illness, there's key elements to that, which is the duration, how long did this happen? What's the severity level? What's the context? Like it's worsened when I'm eating food, especially fried food. The location of it, the upper right quadrant of the abdomen, and it radiates to the back. modifying factors exacerbated by pain and fried foods, and yellowing in the eyes and orange colored urine. So I mean, it nailed it for a lot of the things that are supposed to be in the history of present illness right out of that whole conversation.
And what's interesting is the payers, the insurance companies, will use this document, and they'll have coders look at it, and they have to pick out, based on the level that you're going to bill for this visit, for example, they have to pick out between 5 to 8 components of a history of present illness that have to be present to get the score, basically. So you need to be detailed, and so that this document serves multiple purposes. It conveys information both to the patient, to referring doctors, but it also is a way for insurance companies to vet if the level of care rendered really meets their minimum requirements for the code that was submitted.
Yeah, and I would say this history of present illness ticks most of those boxes, those 8 elements, right? Which is allowing you to bill at a higher level, right? It's a much more complete exam. And then the review of systems, Hugo, the head, ears, eyes, nose, and throat, yellow discoloration noted, abdominal pain for the gastrointestinal, worse when eating, orange color urine for the GI, the physical exam. This would normally come in from the EHR, the vital signs, but we didn't do any of that. The physical exam, the eyes, yellow discoloration. I think you said the lungs were clear. The heart, you said normal rate and rhythm, you said that. The abdominal, normal bowel sounds, you said that. Tenderness in the upper right corner. It actually picked out the Murphy sign. Normal bowel sounds, no bloating. I think it picked all that out, or it picked all that out from what you said. The extremities, no edema in lower.
Just to interrupt for a moment, most EMRs, what you would do actually is you'd have a templated normal exam, and what the AI does is it puts in what's called pertinent positives, which would appear in red. So normally, this is all basically already a generated note with a normal physical exam with all the data points, and then it would just plug in these red pertinent positives, I would say.
Correct.
We just didn't fill out the template part, but that's how you would set it up typically, and that's how we normally have it set up.
Exactly. The assessment, suspected gallstones, possible common bile duct stone. So I think that assessment, Hugo, is very accurate. And then the plan, order abdominal ultrasound to check for gallstones, order liver function tests, follow-up appointment, consider potential tests, possible referral to a GI doctor for liver tests. And then so this was all accurate, I believe, right, Hugo? This is very accurate. And then the billing codes, the ICD-10 billing codes. Let's see, Hugo, what do you think here? So it ties back to the assessment and the plan. These are the billing codes.
Yeah, so those are the ICD-10 codes, and that's what you'd have to submit, and yeah, gives the diagnosis. And then further down, it gives you the summary for the patient, right?
Right. So the summary, this is this is what the patient would get. This is really good too, especially for elderly patients where the family needs to understand what happened in this exam, right? So they could see that, dad went in and this was the outcome of what was said here.